up, YouTube? Today is day one of, I think, 7 of a stretch of night shifts at the hospital. If you're new here, my name is J.R. Smith. I am an intern orthopedic surgery resident at the Mayo Clinic, and I am currently on my general surgery rotation, which has been a fantastic rotation. It's been great, but the challenge of this rotation is that you go from maybe a week of days, and then you'll have kind of like a day off, and then you jump into a week of nights. And so getting the body to be able to handle that appropriately so that you are well rested and energized to perform well at the hospital, coming from days to nights and being just as good at 2 a.m. as you were at 2 p.m. Can be a challenge. But the first thing that I always do is the thing that I least want to do, which is usually studying. So we spent a little bit of time this morning going through our ortho bullets, flashcards, reading a little bit about the brachial plexus. If you're a medical student, you will still need to know about the brachial plexus, especially if you're going into orthopedic surgery. So learn it good the first time, but it's just like what Mark Twain said: if you eat a live frog first thing in the morning, nothing else for the rest of the day will be as bad. Oh, what's up, man?
Harvey, can you eat it? I want to see you eat it.
What are they doing? What are they doing?
Swimming.
Swimming. And what are you doing, Blaze? Chilling. Boom. One of the dopest things about having a little toddler is that their food is amazing for us too. I'm eating Kari's pancakes and sausages. Can I eat your food?
No, it's mine. No,
Whose is it?
Kari.
So I think the first thing that I thought of when I had night shifts was I would need to be sleeping all day throughout the day to be rested at night. And this is probably a pretty common thought process. Perfect time, huh, Car? Okay, we're gonna play flute for a second and then talk a little bit about that. My initial thought process when I was first preparing for night shifts was, okay, during the day I have to sleep the entire day, because my night shift, which today and this entire rotation is 6 p.m. to 6 a.m., that means I need to be sleeping from probably, 7 a.m. to 3 p.m. or something like that. And I think that couldn't work for some people, but for me, I realize that it's just first very hard to sleep during the day. I will definitely try to get a nap, which hopefully we'll see if we get to. But maybe it's because I have a family and I don't know. During the day, everyone's awake and it's hard for me to just want to be in the basement by myself sleeping. But I think another thing that I realized, and I think more importantly, is that there are things that energize me more than just sleep and rest. And so for me, I try to get some time doing things that fill my cup. And so spending time with my family, going on a walk, exercising, those kind of things can provide me with the energy that I need to get through the night shift later on, instead of just thinking that sleep is what I need, the only thing I need to get through the night shift later on. Sleep is definitely part of it, but I don't think it's the only thing. So that's why I'm spending hopefully a couple hours hanging out with the family, and filling my cup that way, because the night shift, it can be tough to see the fam if I'm sleeping all day and then at work throughout the evening and night.
Go. That's go.
Oh,
And then in the wrist.
who is that?
Kari.
Oh, the bakery smells so yummy.
Yeah. Hey, Mama. Look at the coat.
Watching Mr. Rogers.
then this is where you'll find JR, Techie, Apple.
Need one more iPad.
Can you hear the music that we're jamming to?
Oh yeah. Nice.
You want to put it here under the dog food? Does it sound hollow?
What has been the hardest part of residency from your perspective as my wife, now that we're 1 month in?
Well, I think the hardest part is that you're in the hardest part, and that is meaning that, you know, you're waking up at 4 and then coming home later after 7, and Kari is obviously not up at that time, and then he is getting ready for bed. And so as a family, I think that's been hard to spend good quality time together.
I'm hot, Mommy.
Okay, we'll turn on the AC. So I think that's the hardest part.
Yeah. And I'm currently in a quarter of residency. We kind of go every 3 months. We're in a certain quarter, and they call this quarter the quarter of pain. Gen surge trauma is it's kind of like shift work in a sense, because it's like 6 to 6 technically, but I like to get there around 5:30, and sign out is at 6 p.m. so that means I'll usually leave around 6:45. And sometimes if there's an activation, which we'll talk about what that looks like a little later, I could get home at like 7:30 some nights. So this has definitely been a harder kind of season starting residency on such a busy service, rather than if I was starting on sports and had the weekends off and was getting off at 3 or 4 p.m. and that would be a little bit different. What has been a positive that you have noticed that you were not expecting for residency?
Compared to med school, you're not like studying for shelves, you're not doing like a ton of Anki. The only studying that you're doing is ortho bullets, and then like you'll be chart creeping, looking at your patients, see how they're doing. That's just like different than in med school. So
like when I'm home, it's like almost like I'm home more.
Yeah.
I'm not home as much time wise, but when I am home, I don't have as much to do at home. Would you say that's fair?
Yes. Yeah.
Yeah.
It looks different.
Yeah. It is around noon, and I'm gonna try to get an hour or 2, ideally maybe even 3 hours of sleep, quick little nap before the shift starts tonight. We don't have a spare bedroom in the house anymore. What used to be the spare bedroom is now my office. So I just have this mattress in here, air mattress, and use this to try to sleep. So we'll see. Hopefully I can get some rest. Even just banking a couple hours makes the night shift a little easier. So we'll see. Shout out blackout curtains. It is about 3 o'clock. Time to get up, get ready for this night shift, and finally get some caffeine. I just wanted to share what the responsibilities are for the intern on the trauma service. So what will I be doing, or at least I expect to be doing? The first thing is taking care of all of the patients on the floor. This means the patients who came in oftentimes for trauma-related injuries and have probably had surgeries and are now on the hospital floor, either in the ICU or just on our general care floor, and making sure that they are comfortable, safe, stable, all of those things. So responding to pages and phone calls, hopefully not related to hemodynamic instabilities or super scary stuff, but maybe. A lot of these traumas are pretty severe. So making sure that those people on the floor are safe and stable will be one of my primary responsibilities. And the other responsibility, which is probably even more terrifying, is the intern is responsible for responding to all level red and level 1 traumas. So the level of a trauma just responds to its expected severity. For example, maybe a fall from ground level height, so just tripping, but as an elderly person, potentially with multiple fractures, that could be maybe a level green or a level yellow, whereas someone going highway speeds on a motorcycle and they're ejected from the motorcycle, that will probably be a level red. And so as the intern, we are responsible for seeing all of these in our resuscitation bay as they are brought in via ambulance or helicopter, oftentimes, especially for level red traumas, and assessing them with a primary and secondary survey. So basically, what a primary and a secondary survey entails is seeing a patient as they are brought into the resuscitation bay in our emergency room and assessing them based off of things that are most vitally important. Their airway, their breathing, their circulation, types of neurologic injuries or deficits, and then just exposing the patient to see for wounds to all aspects of the patient's body. A lot of times these patients are flown in via helicopter or ambulance then. For the most part, my experience has been a lot of motorcycle crashes, even at highway speeds. So I will never be getting on a motorcycle after this rotation. But just, again, assessing the patient to make sure that the things that are most likely to result in the patient's demise is taken care of first, and then working down the line. And then after I do my primary survey, which again is that ABCDEs of trauma, then I'm going to move on into a secondary survey, which is basically a head-to-toe physical exam, checking for things that are tender to palpation, tender to me pressing on it, checking for blood, checking for lacerations, abrasions, any kind of sign of external trauma, checking for motor response, sensation to the upper and lower extremities, checking for stability of the pelvis, checking for any blood at the meatus, kind of all of these kind of things, just working my way head to toe to try my best to not miss anything. And then we will rotate the patient over and check the posterior surface of the patient, pushing on the spinous processes of the vertebrae and checking for any tenderness there. There will also be, someone running in doing a fast exam potentially, or getting a chest x-ray or pelvis x-ray, all within the resus bay. And so it's a very it seems pretty hectic, especially if you're not part of this team. But for the most part, everyone has a very specific and defined role, and they just do that role, and everyone is kind of moving along in their responsibilities. And if you're just looking out from the outside, you're just like, what is going on? But hopefully by the end, the person leading the resuscitation is going to have all of the information that they need from the primary and secondary survey, from imaging, from labs, from all of those kind of things to be able to make a decision on how the patient needs to be then treated. The first time that I did this, I was absolutely terrified because I didn't feel like I was prepared as someone who had just basically started residency a little over a month ago to now be responsible for making sure that a patient did not die after very traumatic experiences and injuries, and being able to with confidence call out my findings in my primary and secondary survey. They say that the most common complaints for interns when they're doing this is that they're not loud enough, which is only because I think interns are not confident in themselves. And if you don't hear breath sounds, you may just say, I don't know if I hear breath sounds, instead of just saying breath sounds heard on the left, diminished breath sounds on the right, with confidence and with volume. And so again, it can be hectic. So being able to do this with a volume that everyone can hear is important, because people will be making decisions based on what you say and what your exam shows. And so I was terrified about this experience. But what I have learned is that everyone is working as a team, and it's just important to understand that. And you don't have to have confidence necessarily in yourself for doing things perfectly, but you can have confidence in the end result being successful because of the expertise and experience of your team. And so if you go in and you just do your role to the best ability that you can do it, everyone else is also going to be doing that, and the end result is going to be hopefully successful because of the group's effort. And so I now have a lot more confidence, I think, in myself to do my role, but I also have realized how important it is to have confidence in the team, and that when I have confidence in the team, then the kind of pressure I put on myself goes down a little bit, which also allows me to, I think, perform my role even better. So that's been something that I've realized, and I think it's something that as you're an intern and you're doing all of these new experiences and you actually have responsibilities now that are important for a patient's safety, there's going to be nervousness that comes with it, especially when it's your first time doing something. And that is, everyone is going to have that. So when you feel that, understand that the senior consultant who is running the resus has also been in your shoes, having to do a primary and secondary survey for the first time, and knows what that feels like. And everyone in there, whether they're getting labs or doing x-ray, they had to do that for the first time. And it was a scary experience, especially when things are happening so fast and a patient's life could be potentially at stake. But again, I think first realizing that the situation's success is not solely dependent on you is important. And then also understanding that your nervousness is just a reflection of how much you care and how you recognize the importance of what you're doing. If you weren't nervous, I think that would probably be more problematic than being nervous. So I just think the way that we interpret nervousness, anxiety, those feelings as an intern, shapes our reactions and our responses in those settings. So hopefully tonight will be one where there's not too many activations, but if there are, I'm going to walk in with confidence, not only in myself, but in my team, and a recognition that the nervousness that I'm experiencing as the patient is being brought into the resus bay is a reflection of the fact that I care about this patient's well-being and I want to do the best for them.
Hi, buddy. Are you playing with the bubbles? This looks like a vibe. Good daddy see this.
See you in the morning.
I'll see you guys in the morning. Are we gonna have a good day? Can you say good luck, daddy?
Good luck, Daddy.
My night shift has already been a little eventful. It is almost 9 p.m. When I got here, we started sign out at 6 p.m. and we already got a activation at about 6:15 while we were doing sign outs. This was a pre-alert activation, which means that the patient wasn't here. They just were letting us know that the patient would be here, and the ETA, the estimated time of arrival for that patient, was about 6:30. So quickly finished sign out and then ran down to support this patient's ATD accident. Really just a femur fracture. So as an orthopedic surgeon, I was like, okay, cool. We can, as long as all the important, really super important, I mean, the femur is obviously the most important thing in the body, but as long as the chest and the abdomen and the pelvis, all of those things are fine, you know, simple femur fracture is less scary. But still, just being able to be intentional with a very thorough primary and secondary is always important. So did that, then went back, checked in on some of the patients on the floor. A few of the patients we had just admitted and needed to just assess, you know, their DNI, DNR status, which is do not intubate, do not resuscitate orders. When patients are new in the hospital, it's important that you clarify their wishes related to that so that their chart can be updated. And just letting them know that I'm around for the night if anything comes up. Hopefully nothing does. Hopefully they can be tucked away and sleepy. And then as I was walking out of the last patient I was actually seeing, I got another kind of pre-alert activation. So the ETA for this just said unknown, and the workroom for the general surgery team is pretty far from the emergency department. So I went down, checked in on the resus bay, Nobody was there yet, which makes sense because it was just a pre-alert. And I was too nervous to go too far away from the emergency department. So now I'm just here in the mastery lab, which is closer to the ED, and I'll be able to quickly get to the resus bay when this patient gets here. I think this is a kind of a either motorcycle or like a dirt bike kind of accident. So don't have too much information, but we will see, and we'll continue to train this primary and secondary survey skill. So until then, I'm just gonna train my arthroscopic skills, and with this Vertimed, which I absolutely love, that thing right there is my baby. So we're gonna get some work. Quick update, because just had a crazy experience that I want to tell you guys about. Just probably got like 5 pages back to back to back to back. Everything ranging from calling the family member of a patient who discharged earlier today, who was concerned about bleeding coming from the ear. This is a patient who had a head injury, so that was just terrifying, having to, is this something where I need to bring this patient back, or is it something where this patient is actually okay? So it's scary to get that page, call back the nurse, hear that story, and just be terrified. Talk to the family. That's probably gonna be okay, actually. Got another page about another activation that is coming in, and the ETA said unknown. So now I have 2 pending unknown activations that are just gonna come sometime. So one of them was a dirt bike accident, and the other was kind of, I think, some farm equipment rolled over, tractor rollover, something like that. So those will pop up, hopefully not at the exact same time, but at this point, I don't know. And a few patients just with requests for meds and requests for kind of small little things. And so when I'm like on the phone with a patient, with a patient's family member who's concerned about something, and understandably so, and trying to, talk them through something, and I get a kind of a random page about like, can this patient get cough drops or something like that? It's just like, oh my goodness, like, let me put that down. Hopefully I don't forget about that, get back to this phone call. And then I get another page about like, oh, activation coming soon. And I'm like, oh my goodness, do I need to hang this phone up and run to the resus? And it's like, oh, ETA unknown, so they're not here yet. Still talk to this patient. It's just those kind of things, especially when you're not completely sure how to do everything, or if everything is safe. Even some medications, hey, can this patient get cough drops? And I don't even know this patient, and let me look through, is there gonna be any type of interactions with anything? What type of cough drops? Are these normal cough drops? I don't know. So all of these kind of things you can have those moments of just overwhelm. But after we got all of the things tied up, except for these 2 activations that will come hopefully soon, so we can just take care of them and take care of the people, then it's just like, okay, everything's still good, everything's fine. Now that everything's done, I have a second to have this deep breath and a little heart-to-heart with you guys, which actually helps me, so thank you for listening. But we're good. It is 9:49 p.m., so we still have a very long way to go on this night shift, but we're surviving. Well, I don't know if we're thriving, but we're surviving, and you guys will continue to get updates because you guys are my besties, and you get me through the night, so appreciate it. I'm with my junior resident.
Whoa, whoa.
Prince, I'm teaching him how to use the arthroscope.
Let's just pan to the scope right now, where my scores are better in every single area.
Little friendly competition about to go down.
I beat him in every single area. Don't listen to him.
Y'all know who gonna win. All right, random questions while you do your scope work. First question, what's the hardest part of intern year so far?
I think just adjusting
to feeling like you know the least in every space you're in. So it's always trying to figure out a balance of understanding that you're still a learner, but at the same time, you're also a doctor, and you don't want to feel as though you can't give your patient everything. So it's trying to find that balance of giving yourself grace to get better, but at the same time understanding, all right, you got to get on it because people's lives, or at least their quality of life, is depending on you.
It's like you interviewed or something before, huh? You nice. Okay. Question 2. What's easier about residency than you expected? Nothing.
Yeah, that's a tough one, but I would say so far it's the easier. The responsibility in terms of you're still pretty like young on the team, and people still understand, okay, like there's a lot of support with you, but the understanding of the responsibility we have, that hasn't taken that much time for me to understand and appreciate. Because sometimes you feel as though like, oh gosh, like as I'm transitioning from medical student to doctor and resident, like taking full grasp of the weight of your decisions and how you approach the day and how you approach your work. And I wouldn't say that's been too hard, because I understand, like, okay, what I do matters, and I can't be willy-nilly with things. I can't just accept not knowing the order, not remembering something because the team is depending on me to be professional. So I would say that's been better than expected, at least my mindset in terms of understanding I have a responsibility right now.
No, I like that. Last question. How do you approach going from day shifts to night shifts?
So I think that one's hard. And it also depends on if you're going on a string of nights versus a string of days. But I think the best thing to do is, if you know you're about to go from days to nights and there's maybe a day in between, try to stay up and force yourself to be so tired where you fall asleep at the time you're going to need to fall asleep. So if I'm going onto a night shift from days, I'm going to stay up during that day off that I have, and then end up falling asleep the morning of my night shift. So then my body gets used to sleeping during the day and being up during the night, and vice versa.
It's about 4 a.m. I probably could have honestly got an extra hour of sleep, but I was a little nervous because, you know, you just never know when you're going to get an activation or when you're going to get a page because somebody is in incredible pain or what. So I just was trying to just stay up throughout the entire shift, hang out in the mastery lab, and it was nice because Prince, one of my closest friends, is also on a night shift, as you saw. So just staying up together and getting through that. But it got to the point of kind of got that little like sleep delirium kind of going on when you're just like, you know, so sleepy, you're just goofy. And usually you don't have that many opportunities to rest. So when you do have them, when it seems like everyone is tucked away, when it's so late that hopefully people are at home and not doing crazy, stupid things that get them hurt, this is time when you could catch up and just get an hour or two added to that 2 hour or so nap that I had earlier in the day. So that's what I'm going to try to do. It's about 4 and I have sign out at 6, so I will probably try to be back in the workroom at around like 5:15 or so. So just a quick little hour. Honestly, sometimes that can do wonders. So overall, this was a pretty nice night shift, and I think this is representative of how so many of the night shifts that I've experienced so far are. Early on, it can be extremely hectic and busy, and you feel like you're running in thousands of different directions, and then it's like 2 a.m. or so, and things start quieting down. You're starting to get less pages and less messages from nurses, and activations don't seem to be happening anymore, and another hour goes by and nothing happened at all, and then it's like, okay, we're done for the night. So, you know, night shifts can be scary, but they
points of them can be really fun and really chill. And when you get to do them with friends, like Prince, who's also on a night shift, he's in the ICU, the surgical ICU, it's even more fun. So I'm gonna get this nap, and I'll see you guys when I wake up pretty soon, in like an hour. And just like that, I am home. Night shift number 1 of this week is over. And it was a good shift. It's about 7 in the morning. I got about an hour of sleep. I think I slept from I think I ended up falling asleep like at 4 and then got up at 5 because then we have sign out at 6. So woke up, checked the charts and the vitals of the patients on the floor. My team left with 17 patients and are coming back with 21 patients because we had 4 news that we added to the list. So just checking, going through those 21 patients and getting ready to sign all of them out for the day team so that they can continue to get good care. So the summer especially is busy with trauma. There are seasons where the list is like 7, 8, maybe even less patients. But in the summer on trauma, you're gonna be busy. So the way my schedule works, I got summer and trauma, which honestly, I think when I started the rotation, I was a little nervous and a little like, oh, I have the tough schedule. And you get to these points of like almost wanting things to be easier. And I think that's the default because so much of residency is hard that if you can catch a break with something that's easy, like getting trauma in December when your list is gonna be like 7 patients. You almost like seek those kind of things because everything else is hard. So if you can catch a break, it's like, okay, this is great, thank God. But if you don't catch that break, then you kind of get into the rut of complaining about things and I have the hard schedule or whatever. But in reality, the purpose of, if we always go back to purpose, right, then we get a little bit of clarity. And for me, the purpose of residency is to get the best training that I can to be able to effectively take care of my future patients when I am no longer a resident and actually a consultant. And the best way to get great training is through repetitions and experience. And if having a busier schedule, makes it so that I don't maybe sleep as much or have to get multiple pages all at once and cause me to go into a 5-minute panic of, oh my goodness, this plus this, what do I do first? And now I get a new page of this, oh, an activation is coming, and kind of dealing with the anxieties of those moments. But if that's what it takes for the added experience and added reps and learning that will contribute to my ability to take care of patients better in the future, that's worth it, and the days always come to an end. And at the end of it, you always look back and it's like, that wasn't that bad. So that was just maybe a little soliloquy for myself, but hopefully this resonates with someone watching. And you can also think of, being busy is actually a good thing. So I'm hoping that I get to be busy. It's a hard thing to get your brain to wrap around, but ultimately I think it'll be better for us in the future as trainees. So that's it for this vlog. I hope that you enjoyed it. If you did, make sure to like and subscribe if you haven't already. And you may enjoy this vlog here where I go through a day on hand call. So similar, but now just focusing on the hand. But as always, keep evolving and I'll see you guys in the next one.